Hello, I'm Jean Pete, and I welcome you back to our show, Better Living. Better Living is brought to you by the Homestead Hope Foundation and is sponsored by Homestead Hospice, where commitment to education and premier hospice care helps patients and families through life's most important journey. Thanks for joining me again this week. I'm Jeannie Pete, and again, I'm here this week with another great guest, Richard Hunter, who is with Patient Relations in the Atlanta market and community, and he is here to represent GenCare. We're going to hear all about what GenCare is, but from what I gather, and we'll learn more as we discuss, it is a primary care center, or one of many centers throughout 6 states in the United States. And Richard is here today to talk about how it might be different than typical primary care and the benefits of patients to GenCare offices. Did I get that right, Richard?
You got it. Absolutely
okay, great.
Right.
So first, let's talk a little bit about you. Who are you? How'd you get involved with this? How long have you been with GenCare? What's your story?
Who am I? I'm Richard.
In 2 minutes.
Right, yeah, I'm Richard. I do the patient and community relations for GenCare neighborhood medical centers. And you got it absolutely right. We're primary care, and we focus on seniors. And so we're a little different in the fact that we only deal with seniors. And we're a little more, I tell people, we're more than a primary care, we're less than a hospital. So I think we're that good mix in the middle where we're kind of a one-stop shop for seniors.
Okay, more than primary care and less than a hospital. What exactly does that mean? You have more state-of-the-art technology, so you can do more on site? That's what comes to mind. I might be wrong.
But on top of that, we do things a little bit different, focusing on the senior. As an example, coordinating the care for seniors. If a senior goes to the primary doctor that they use, and the doctor says, hey, we see something on a test, and we want you to go out to a cardiologist and find out more. That becomes a problem in the real world because you leave your doctor's office, they send you somewhere else, and that other doctor is now supposed to work with your primary care to get it right. And in the real world, a lot of times it doesn't happen. So what happens in GenCare is we have a cardiologist in our centers.
Okay.
And so your primary doctor is able to work with your cardiologist because they sit next to each other, and the podiatrist. And,
So let's talk about the specialists then. So you have PCP, primary care. You already said you have cardiology.
Yep.
How about pulmonology?
In each one of our centers, our patient panel really determines the specialists that we have. As an example, in the Atlanta market, we're getting a lot of requests for dermatology.
Okay.
And so we're on the map now to bring in dermatology, which I didn't think would be a big push for some of those markets. But each market's a little bit different. As an example, in the Virginia market, we have a lot of requests for neurology. So we have a neurologist in the Virginia market. And so that's kind of how we...
So you look at your patient population, identify the needs, and hire accordingly to meet the needs of your patients?
Correct.
Okay. Now, let's talk about dermatology, because I have a personal story on that, and I'm not surprised that there's an increase in need for dermatology in Atlanta, because I did move down here from Boston. We were talking about where I'm from prior to the show. But the sun is dangerous. And it's more dangerous in the South.
It is.
And it seems as though skin cancers, it doesn't just seem, the statistics are out there that skin cancers are on the rise. So when you say dermatologists, do you mean like skin cancer specialists or strict dermatologists?
A little bit of both.
Who can detect at least, even if they
Right.
can't treat.
Right.
Okay. Because, and I'm going to get on my soapbox here for just a minute because I have to. It's in me. But I had a skin cancer specialist on this show last July, and I thought, oh, you know what? After I talked to him, I should really go and get checked. So I went and got checked and found out I had melanoma. I had to have it removed. And had I waited 3 to 6 months, I would probably be in some severe treatment right now and may not be here next year. Because as we know, melanoma moves very quickly.
Yes.
So just because you mentioned dermatologists, I just want to kind of get out there again, folks. Go and get your skin checked, full body skin check, get a baseline, know that you're okay. I don't care what nationality, background you are, it is on the rise, especially if you're fair-skinned, blue-eyed with freckles.
From Boston.
From Boston.
Right.
So anyway, okay, so it's nice that you have dermatology. I'm not surprised.
No, we
I think
have
that's
that,
a growing field.
And I think the big thing about what you just said is having good regular care. And so many times what happens to the health industry in general is that we go when there's a problem. I say, we go to the doctor when there's a fire. And if there's no fire, then I'm not going. Our average patient at GenCare is 74 years old.
Okay, I was going to ask. Okay.
74 years old. And we love them. We love our seniors. I was raised by my grandfather, so that's one of the reasons GenCare really endeared to me is that my grandfather raised me. And I know a lot of people are partly at least raised by their grandparents. I know in the summertime, almost all of my friends were sent off to their grandparents in one form or another. But we really push for our seniors to get good, regular care. And the problem that we're seeing now is we're seeing a lot of primary care doctors leave the Medicare field and leave the Medicare area. Yeah,
because you're focusing on seniors. Your average age is 74.
Yep.
And I'm going to ask you, what are the effects of Obamacare? Is this because it's a high Medicare population? How is this helping or hurting? Or because you see a lot of seniors who can't find doctors now, and a lot of them are moving down here in Atlanta,
moving south
because they're middle-aged sons or daughters moved here to raise families, and now as one spouse goes or they start to lose their health, they're coming down to be. We're seeing the second generation, which is the older generation, coming down to meet us here in Atlanta, and I'm sure that goes to our other markets as well. Phoenix is the same. So anyway, with that older generation, they need to find doctors. We do know that first of all, there's a shortage of physicians. Second of all, there's a outflux of retiring physicians.
There is.
Or influx, whatever the proper grammar there is. But what I'm saying is a lot of doctors are leaving.
Correct.
Because of all the changes in healthcare. And so how does that affect someone who's older, trying to establish a relationship with a physician and finding it harder and harder to find physicians that are accepting Medicare?
I think that that's why GenCare is trying to fill that void, because you're right. There is a problem with primary care doctors leaving the senior population. And one of the reasons that we see that trend is that as you get older, chronic illnesses kind of kick in a little more. Diabetes, high blood pressure, heart disease, pulmonary issues, all of those things kind of add in a little stronger as you get older. And so you're going to see that a little more. And so for a physician to kind of defend the doctors for just a second, when we see an older patient, we're really seeing like 4 or 5 different patients rolled into one.
That's right.
And so if we see a senior that's 74 with diabetes, that almost automatically tells us we need to really look at high blood pressure. We need to look at wound care because there's diabetes. We need to look at cardiology issues, heart issues, those type of things, because diabetes is that chronic illness that kind of flames up all of those other fires. And so when you're a primary care doctor and you see a senior walk into your office, you're looking at 4 or 5 different patients. You're looking at your diabetes patient. You're looking at your high blood pressure patient. You're looking at this guy who may have 4 or 5 real issues. And that's why I think it's so important that seniors really make sure they have a great relationship with their doctor. They find out how many patients that doctor has, because the average doctor in the country is seeing about 2,000 patients per doctor. So your doctor has 2,000 other people that he's trying to see. And so that's why patients are saying, hey, I don't get enough time with my doctor. They're not sitting with me. I go in and I'm talking to the nurse and I'm talking to the front desk and I see the doctor for 5 minutes. And those are the things that we really push back on. We limit our doctors to 450 patients, which is, 25-30% of what a primary care doctor normally would see. Because we're seeing that patient for 5 different, issues. We want our doctors spending a lot more time. And so, find, if GenCare is not in your market.
How does that work, though? I love what you're saying. And just to back up a minute, I am absolutely I feel for the physicians.
Yeah.
I really do, because
Yes.
they are being pushed more and more and more. Record on the EMR, electronic medical record system,
Yep.
while the patient's in the room. So it's even harder to have eye contact.
Right.
And hurry them in and hurry them out, and hire more physician assistants and nurse practitioners to really do your job, and then just come in, assess, and walk out. And it's not the poor physician, it's the model that's hurting us. Our
Correct.
healthcare in this country is hurting us.
Correct.
Which I think is affecting as well. I mean, we could do 4 radio shows just on this topic, but the number of people who actually want to go into medical care
Right.
now. Not to mention the folks that we already mentioned that are retiring or getting out of the business. But so my curiosity is, if GenCare can do it, why can't this be done more often? So what is your model? How do you make it work? How do you say to a doctor, okay, instead of the revenue you're going to get to pay off all your enormous medical bills that we charge you an over ridiculous amount to get your degree, now instead of 4,000 patients, we're going to make you cap that off at 450, and don't you want to come work for us? I love it for the patient, but really, how does that work, and does that mean there's going to be higher turnover? Let's talk about that.
As far as higher turnover for GenCare,
How do you do it? How
well,
does the
it's funny
model
that you
work?
ask. Our CEO is the son of our founder, who is Dr. Chen, Dr. Chris Chen. And he's gone to Washington. He sat with the president a few times. And our model is really, really catching on, and there's been a huge amount of focus
I hope so.
in Washington and with the politicians. And our model is really, it goes against everything that you're supposed to do in medicine right now. And so we're really looking at the high touch, the way the model works now. The healthcare model now is, again, something happens, there's a fire, you go in, you see the doctor, they fix the problem, or try to fix the problem, or mend the problem. But what we're seeing is that more and more people, because they're not getting good regular care, they end up in the emergency room. And the bottom line
and
is...
that's going to get worse because costs are going up
and
like
that's where
crazy, so people aren't going.
It hurts everybody when, and I'm not saying don't go to the emergency room. Please go if you need it. But what happens is you get so many people going to the emergency room because they have a cough, or because they have flu-like symptoms, and they end up in the emergency room, where a good primary care relationship with a doctor would fix a lot of those things. Now they're not in the emergency rooms. They're not clogging the hospitals. They're not in those issues. And so now they're getting good regular care. And so it's not a fire. We're fixing just normal health issues, and they're not going into the emergency room, because that's where we end up kind of bottlenecking it, and that's where the cost is. I mean, the bottom line, that's where the cost is.
Yeah. But if you have older folks, and I'm just trying to understand it, is there a pay to play for these kind of doctors? Do you pay an annual amount so that you're only one of 450, kind of like a VIP doctor program?
No,
it's just you choose a GenCare doctor. You're guaranteed these doctors have less patients. They're going to see you longer. You're going to get better care, and it costs you no more money than other models.
Exactly. And here's the bottom line of that model. This is how it works. The healthier we keep our patients, the happier the insurers, the payers are. And so they bonus us for keeping our patients healthy.
So you can pass that through to the physicians to keep them.
Exactly.
Okay,
and so the model actually does work if it goes the other way, which is, the healthier I keep you, the better I do as a company. And I like that model. I want my doctor to be motivated to keep me healthy, because that's the bottom line. It's not, fix me, because I'm broken. It's more keep me working good. And sure, I want my doctor to be on that list, the guy that keeps all of his patients healthy.
Okay. Okay, so you have specialists, and they can go right next door. And that is frustrating, even for me. As a woman, I go see the primary care. Okay, it's time for a mammogram. Now you got to go to the next town over, across from the hospital. Right. They'll send us the results. That is a bit frustrating.
Well,
unless you have a doctor right next to a hospital.
Imagine doing that at 80 years old, and you're not driving anymore.
Right.
And you're asking friends and family and daughters and siblings to take you to these appointments and to run you to, Walmart card for your prescription.
Right.
And, and again, we just said a lot of times there are 4 or 5 different patients. So they're going to nephrology for a kidney issue. They're going to another, center for diabetes. They're going to their cardiologist. They're going to their pulmonary specialist. And then they're going to get prescriptions for each one of these doctors as well. And so, yeah, you're talking about, 10 trips on average to 10 different places.
Okay. So then we skipped some info, but I think you said it. So you not only have specialty doctors, but you have a pharmacy.
Yes.
And lab.
Yes.
And
we do our own ultrasounds,
okay.
And we've got a digital X-ray
imaging
system.
Center.
Imaging.
Okay,
We
I was
do
trying
imaging.
to think of the word. Okay.
Mm-hmm. And what we're trying to do is we're trying to make it.
So this is like a little mini hospital that you're going to.
It is. We're trying to make it a really thoughtful place. So, we're thinking if you go to the doctor, you want that doctor to be able to take care of more than just, one single issue. You want them to be able to kind of cover the whole gamut. You hurt your arm, you banged it really hard. Let's get an X-ray. And that shouldn't be, well, let's set an appointment. Well, let's get you to another place, and then when they give us the records back, we'll do this, we'll do that. In an ideal situation, you're wanting to say, why can't we do it right here? Why can't we do it right now, right here? And I'm comfortable with that doctor, and that doctor can diagnose me. And if there's an issue, we can even prescribe medicine and hand you that medicine right here, right now, versus, again, sending you 2 miles down the street.
I love it. I can actually wrap my head around it. It's like a hospital, but there's no inpatient stay.
Correct.
If you need inpatient, then you need to get sent to the regular hospital as we've known it for years and decades.
Yep. And that's what hospitals are really good for, hospitalization, not primary care.
Right. But outside of that, you can do the rest at a cheaper rate.
We can.
Which is why it works for Medicare patients.
And one of the barriers to health, I like to tell people, the reason that I didn't drive my Lamborghini today, to come and talk to you today, I mean, the real reason I didn't drive my Lamborghini is because I can't afford a Lamborghini.
I was going to say, because I don't have one.
Yeah, I don't have one either. I can't afford it, and it's always kind of a funny joke, but it's not funny when you can't afford to be healthy or you can't afford to go to a doctor. That's when it's kind of not very funny anymore.
For my listeners, I'm going to say it again. I'm sorry I say it every week, but I'm still not over it. After I got over the whole melanoma issue and got all those bills in, I had an emergency appendectomy. One night in the hospital.
Okay.
And I'm not going to mention which hospital. My portion.
One night.
For the doctor, anesthesiologist, hotel. I call it a hotel stay. It's far more expensive
than a hotel. Very expensive hotel.
The hotel alone, the hospital, one night, my portion, $5,000.
Holy
$38,000 is what they charged to keep me one night in that hospital. I said, my God, I could live in my house for years.
Yeah.
For that amount of money. That's ridiculous.
That's why we're trying to keep our seniors out of the emergency rooms and out of the hospitals. It's just so expensive. At GenCare, we have a financial waiver. And the really important thing about the financial waiver is that if our patients make below a certain amount of income, we are able to then put them in a program where we're not charging them their copays. And so it's really, really working because now the seniors are more focused on their health than having to focus, like you said, on all the trails of bills that follow behind going to the doctor. Because when you're on a fixed income, you've got limited resources. Now, going to the doctor, you're almost scared to go because the bills are going to follow. And
usually seniors, this show is geared towards seniors. I have a passion for making sure that we take good care of our seniors. I mean, they got us to where we are. It's time for us to give back and make sure that they live their best life.
Amen.
Till the end of their life. But this is one place where they may benefit versus the rest of the population with all the changes in Obamacare. Because they are now being pooled in a population with much younger people than they used to be pooled with.
Right.
Their insurance costs, hopefully, this is what they say, but we're not sure if this is happening, should remain the same or go down for the same care because they're of Medicare age. Is that right?
Correct.
Okay. So here's one instance where Obamacare, I'm not a huge fan, but that is helpful to our seniors.
It is. I think one of the big things that I kind of, I'm not a politician and I know what I like and I know what I don't like. So, I'm kind of in the middle myself.
I know I don't like a $5,000 bill.
You're not going to like it. But I think they gave more power back to the doctors over the insurance companies to do things like that, to be able to say, hey, if there's a copay, if there's a portion that I charge as a doctor, I get more control over charging or not charging or waiving or coming up with a program that works for my patients so that I can get them in and I can keep them healthy. And that's really important for your doctor to have that kind of power.
Well, and you're running the gamut. So like you said, you are a one-stop shop. So it's in your benefit to take the best care of your patient possible, because then you're keeping it within your own center, doctors, and to some extent that model would work and help you provide better care. I saw it. I went to a clinic first, didn't know what was happening to me. Then I got told you need to take an ambulance to the hospital. I said, I'm not paying the ambulance fee. Drove over, thank God. So now I'm getting a bill for the clinic that couldn't do a thing for me.
Yeah.
And a bill for the hospital. It's ridiculousness. So I actually, as you're talking more and more, I am seeing the benefits of the Gen Care centers. And I want people to understand, we're not just talking about a primary care physician. We're talking about a center for comprehensive care, really.
Yes.
And that's the difference right there.
That's the big difference. Again, seniors have that challenge where, you take Jeannie Pete, she's having this issue, but now she's 80. She's not driving anymore. And go through that same scenario that you just ran through that was super expensive, complicated, nerve-wracking, and do that at 80 years old. And so, that's where we're really trying to advocate to be that one-stop shop, because, honestly, really important thing that I learned is doctors, they go through medical school, they go through residency, they do all of these things in groups. Doctors work in groups all, their education long. And then they become doctors and they all split up and go work in their own, places. And the whole time they were educated and trained how to work together. And so, the Gen Care model puts the primary care doctors with cardiologists.
And the same medical
in the same place.
The recording system. So you all have access to the same information and you're not HIPAA bound and trying to figure out what's going on and missing stuff.
So if I prescribe something for diabetes and someone else prescribes something for, a wound issue or something, we're going in the same system. And we see what the other doctors are doing, and we're all able to work together versus working separately, and that separate keeping the doctor separate becomes an issue. Because,
absolutely. Listen, we never have enough time, but I do want to tell a story about that real quickly. My father was in the hospital for something digestive, and while there, the doctor came up to me and said, you really need to do something about that mass in his lung that we told you about 10 months ago. I said, what are you talking about? Never told us about anything, never forwarded it to the primary care physician, and we lost him to lung cancer because we didn't catch it early enough, because when he was in the ER, it didn't go back to the primary care physician. So love that it's all in one system. People don't realize what a benefit that is to be able to pull up information on the patient. Now, if somebody wanted to go to a Gen Care center, get a Gen Care physician, find out more about it, how can they contact Gen Care? Who should they call?
Our website is really great. Our website is www.gencaremed.com, GenCareMed.com. And that way they can locate a center that's close to them. They can reach out and find us. And, the last piece is that we also provide transportation to our centers. If you're living within, a 6 to 8 mile radius, we'll pick up and drop off. So, again, because if you can't get to the center, that's a huge barrier.
Yeah, it's a big deal here in Georgia, too. Yeah. Gen Care is in 6 states, Florida, Georgia, Louisiana, Illinois, Virginia, and Kentucky. And what about an 800 number or a phone number they can contact Gen Care at?
Yeah.
The Candler Road here, 404-406-7389?
Yes.
Okay, terrific. Yep. So again, that's www.gencaremed.com. If you're looking for a primary care physician or a physician center, a center where they can do not just primary care, but specialties and labs and transportation and pharmacy, so many benefits, you can contact Gen Care at 404-406-7389 or go to their website at www.gencaremed.com. We have to take a quick break. Stay with me. We'll be right back. Hello, I'm Jean Pete, and I welcome you back to our show, Better Living. Better Living is brought to you by the Homestead Hope Foundation and is sponsored by Homestead Hospice, where commitment to education and premier hospice care helps patients and families through life's most important journey. I'm Jean Pete. I'm back with our Gen Care representative, Richard Hunter. Did I get that right, Richard?
Yep.
Okay. And thanks for staying with us. At the first part of the show, we talked about what Gen Care is. And I didn't know prior to today's show, it is not a primary care physician office. Gen Care is a model of care where there's not only primary care physicians, but there's specialty physicians, and there's labs, and there's an imaging center, and there's cardiologists. And we touched upon this right before the break, so I want to get more into it. They provide transportation. They specialize, Gen Care centers, in the Medicare population, which is the older adults. And their average age is 74 years old. So if you are, like me, parents are moving down, need a physician, I sent them to my primary care physician, but it might be that my mom and stepdad would have been better taking a look at a Gen Care office. So we want to get the word out for you. This is called Better Living, and anything I can do to bring information to you to help you live your best life for every breath of life you have left in you, then I feel blessed. So, Gen Care centers are something to think about, especially if you're of Medicare age. The one-stop shop, being able to keep costs down.
Yep.
The important thing to remember is typical physicians have thousands of patients that they see. These physicians are capped off at 450, Richard?
Yep.
So they're going to have more time to spend with you. And somehow, which I haven't quite wrapped my head around this part yet, Gen Care is able to keep costs down because I think it's more like a hospital, but without the expensive costs of inpatient stays. So without those expensive inpatient costs, you're able to do almost everything else for your patients while keeping those costs down. Did I get that right?
You did.
Okay,
You
it's
did.
just an assumption on my part. Okay, so before we get into what LifeCard is, what your plans are for 2014 around Atlanta, wrap it up with the top 3 most important things you want folks to know about Gen Care. First, I want to talk about what you mentioned right before the break. You all provide transportation.
Yes.
And I know from working in healthcare just how important that is.
Yes.
And can tell you lots of stories of how that would have impacted people that I've known.
Yes.
So talk about that, please.
Transportation for a senior. If you work in the senior market, it's huge. It's a huge issue because number one, if you can't get to the doctor, you can't get examined. You can't get the diagnosis. So, the first step is actually getting to the doctor's office. And so each one of our centers has a van that can hold up to 15 people, has a TV, we're playing videos, it's wrapped. So you see
It's
our
wrapped.
names. We have our we do
comes in
wrap
a
on the
special packaging
with a bow.
No.
We have our pictures and our phone numbers, and so when you see our van, that's a Gen Care transportation, and I think that's huge because seniors want to know, who is this that's coming up to my door or that's pulling into our driveway, and one look and that's a Gen Care transportation.
It's just a transportation vehicle though, right?
Correct.
It's not, it's like basic transportation to and from a physician's office. Because some folks,
Correct.
if you need an ambulance, you need an ambulance. That's a whole different kind of transportation.
Thing. This is for appointments that you have with Gen Care, and you need to come in and you're seeing us for some sort of appointment that you've made with us.
But let me ask you this: it's wheelchair capable, or do you have to be able to walk in it? Even if you have a wheelchair, can you store it, or how does that work? I'm just trying to see what kind of van transportation this is.
If you can walk on the van, we do transportation. It's not wheelchair accessible for motorized wheelchairs.
Okay.
But a lot of times our seniors are in a wheelchair, but they can go a few feet on their own. And in that situation, we can take the wheelchair and put it on the van.
Okay.
And so we're right there in the middle.
So is it like these vans like at the airport that transport you back and forth from the terminal to the parking lot?
Yeah,
in a place for
exactly.
luggage or
really,
wheelchairs?
really
Okay.
similar to that.
Okay.
But we did some thoughtful things. Our seats are just a little bit wider, and so little things like that where we've got some larger seats just to be a little more comfortable. we've put on, like I said, a DVD so that there's a little something going on while you're coming, to and fro, just to make it a little more interesting. So, yeah.
I love the idea that you provide transportation because I have worked in healthcare in Georgia for a long time and hospice and home care. And what we see often is folks that just couldn't get to the doctor anymore. They're older, they're homebound, and it's cold, or their loved ones aren't around.
Yeah.
And they just don't go to see the doctor. And then when I was, very active in hospice, we'd get phone calls and they wouldn't have seen a doctor in 2 years. And, you think, what would have happened had they been getting preventative care all of this time? So I love that and a lot of the physicians' offices that used to provide the transportation that were near the hospitals, that was one of the first cuts to go.
Right.
When there was a money crunch. So a lot of folks used to take the transportation and then all of a sudden it wasn't offered to them anymore. So this is very different and does differentiate you. Yeah. Another reason why a senior might want to look at a Gen Care center instead of maybe a different type of primary care physician.
Exactly. Gen Care is only focused on seniors. You start Medicare, think about Gen Care because we're doing a lot of things that I know are very thoughtful for seniors. Another thing that's kind of, just kind of interesting about our transportation, a lot of our centers are very close to shopping areas. So, a lot of seniors will come for their appointments, go shopping.
Make a day of it.
Yeah.
Will the van take them to the mall?
Well, we're not dropping off over at Lenox Mall or anything like that. But most of our centers, like I said, are near other shopping areas and grocery stores and things like that. And so a lot of our seniors will have their appointment, walk over to the next store, go grocery shopping, get on. Make like you said, make a day of it. And so
that makes sense because it's hard to get out.
And it makes it easy. Great. It makes it easy for the senior.
Which is huge because another thing I know is there are seniors that are going hungry because sometimes they can't afford it on their budget, but also because they can't get out to get the food.
Right.
Right. And so I love that. That's just another perk that's a huge benefit. Okay, so you have 5 centers throughout Atlanta?
We do.
Where are they located?
We've got a West End location, which is on Ralph David Abernathy. We've got an East Point location on Headland and Delowe. We have a Morrow location on Mount Zion Road. We have a North location on Buford Highway. And our headquarters and our largest center is South DeKalb on Candler Road. And
do you plan to grow offices in the Atlanta area?
We are.
Okay, because you're mostly in the South here. I live in Kennesaw.
Yeah.
There ain't nothing going on up there.
We're making our way to Kennesaw. We're not there yet. Give us a minute. We're heading that direction. But we are. We moved into Atlanta in 2003. We're a 25-year-old company. We got to Atlanta in 2013, and we put 5 centers in the city, and the reaction has been incredible.
You've only been here a year.
We've only been here a year.
Okay.
But the reaction has been great, like really great. Advocates for the seniors, so the families are seeing what we provide. They're loving it. Seniors are coming in themselves. They're loving it. A lot of senior communities and residences, they're seeing what we offer. They're loving it.
I bet they are.
One thing that Gen Care is really big on is they're really big on working with the advocate. So as an example, if the senior lives in a senior community, we don't bypass the managers or the coordinators of the senior communities. We invite them to come and see the center. So we want them to see where they're sending their residents, their seniors, their people. And so we really do try to bring in the other people that support the seniors to our centers as well. So we want them to see what's going on because, that's another thing. You've got this, you've got a senior with
physicians to come into the buildings because their hands are tied. They want to be able to take care of their residents. But it's hard to find physicians that can come into a building for 1, 2, 3, 5 patients.
Correct.
It's not economically sound. So unless most of the residents in the facility sign up for the physician, it's not really worth the physician's while with everything else they've got to
And then
deal
how
with.
much can that physician bring
and then
with
what
them?
What can they do
Right.
when they get there? They're just a person.
Right.
So this is great. So you could send a van or they could use their van, whatever you all work out, so you can keep your van for the folks that are homebound. And they could send several at a time.
Correct.
And they could rotate so they could keep track of regular visits to physicians for all of the residents. I see so many benefits there.
Yeah, and I'll tell you, regular visits mean the world to a senior. Our patient panels, we've done studies on our patient panels, and we have 38% fewer hospital days per senior with our patient panel. So that means if you look at a pool of seniors with one doctor and a pool of seniors with GenCare, our patients are spending 38% less time in hospitals, where it's expensive, where there's problems, where those are issues. We've got 38% less. And
38%. That's a large percentage. That's an impact.
Yeah.
That's nothing small, right?
I mean,
there.
when you look at it and you go from one center or one doctor to our center, it really does show that our model works. We're keeping our seniors healthier. We're addressing issues quicker. We're coordinating those issues. You mentioned the story where, you went to the emergency room, your father, had a mass, and then 10 months later they say, oh yeah, by the way. I mean, that's horrible.
Yep, primary care physician never got the report. They sent the report on the GI issue,
right,
and completely forgot.
Because the doctors aren't always talking to each other.
Yep.
They're not able. They're busy seeing those 2,000 patients. They're not able to stop and say, "Hey, wait a minute. Here's something that's going on." But if those doctors were standing next to each other, or offices were back to back, or if they were right there with each other, it'd be a lot easier to coordinate the care of their patients. And that's what we're doing at GenCare. Our cardiologist is standing right next to your primary care, so it's I wonder if he got the report. They're standing right here. We're all accountable. Our doctors are very accountable because they're standing right in front of the other person. It's hard to not be accountable when you're right in the room with them.
And you have studies that show this 38% less hospital stay. And not only that,
we've taken those studies to Washington to show them that these models work for our seniors, and it works. It really could work for anyone, but especially our seniors, because they're just so much more vulnerable to these issues.
And sicker, I mean, there are studies that show the last 2 years of your life is when you spend the most amount of money. I think it's an average of $2,000 something on your health care, which is going to be a lot higher now. And then also, just to take that one step further, these same studies or different studies show that you, on average, affect the lifespan of your patients by helping them to live on average 5 years longer.
Correct.
That's a lot.
That's a lot. When you can add 5 years to the lifespan of someone, that's huge. And not just adding 5 okay years. I mean, 5 good years, healthy, issue-free type years. That's huge, for a family. I mean, if, a lot of people are looking at their family and their loved ones that have passed. What if you had 5 more years with that person? And so our studies are showing that what we're doing makes sense. Coordinating care, like you had mentioned, if you can get to issues quicker, you can fight them better. And, and that's the big thing. You don't want to fight health issues from the back. You want to approach health issues in the best way, which is usually catching it early, and that's what regular good primary care will do, and coordinated care will do. It finds health issues earlier, and it keeps you living a good life longer.
Okay, what is this life card? Does that have to do with this coordination of care you're talking about?
It does. It has to do with a lot of things. When you become a patient with GenCare, we give you basically, it's like an ID. It has your picture on it. It has allergies or conditions that you may have going on with you. And the really important thing is it has our doctor's phone numbers. So if there is an emergency, you have a doctor's phone number on you. And on the back of our life card, we put your last EKG on the back of your card. And so, a lot of issues when you go into the hospital and you have chest pains. An emergency room doctor that has never seen you before now has to make health medical decisions on you, and they've never seen you before. And so the life card really does help that doctor to find out something. And so having that EKG, your last EKG on the back of that card, tells you, that doctor, this is what my heart is supposed to look like, and so it gives them some good information. And we've seen that card has saved lives in the past.
I can see how that would. You did mention something. It has your primary care physician's name and phone number on there. That's important as well. But that makes me wonder, how many primary care physicians does each center house?
It depends on the center. We've got some centers that are a little smaller, and they may have 1 or 2. And like the center in South DeKalb, we've got 4.
Okay.
So we've got 4. And our medical director is in our South DeKalb location, Dr. Susan Shays. And she is awesome. She doesn't shake your hand; she hugs you. So,
that's nice.
I'm going to tell you now. If you meet Dr. Susan Shea, she's going to push your hand out of the way, and she's going to hug all over you. She loves seniors. She loves them.
And now, do you have a model that uses physician's assistants and nurse practitioners as well?
We've got a really simple system in what we call in the back area, in the exam room areas. We've got medical assistants, and we've got doctors. That's it. We keep it really, really simple.
So you're going to see your doctor.
You're going to spend a lot more
time with your PA. You're not going to see your PA
doctor.
or your NP. You're going to see your doctor.
You're going to see your doctor. You're going to know your doctor. You're going to spend a lot of time with your doctor. We try to keep the same primary care doctor with that patient 95% of the time. So, I relate it to sports. If you work with the same coach for a long period of time, you can work on something. But if every time you go to practice, there's a new coach, you can never really build on anything. And so we want that doctor to have a real relationship with the patient, want them to get to know that patient. We want them to work on whatever issues are going on with that patient over a long period of time, not rotate you through whoever's up next kind of, model. We want you to really, spend time with that primary care doctor for a long period.
One more question for you. As you speak, things kind of move in my head.
Yeah.
What about hours? Are they the typical primary care physician hours, or because it's a center, is there also a benefit that your hours are longer? I'm making assumptions here.
Right. No, we're 7:30 in the morning to 4:30 in the afternoon, Monday through Friday. So, we're not urgent care where we're 24 hours a day. But the benefit of that is our medical director likes to say, a happy doctor can make a happy patient. We don't kill our doctors. We don't have them seeing 5,000 people a day, and then the doctor's burnt. They're not able to focus. They're not able to get. They have a good balance between the doctors actually being able to have a life, outside of our centers. But we do have on call, and we really, really stress to our patients. Our on call is very, very good, and we're really serious about it. So if you have an issue at 7:30 or 9 o'clock at night, call that number. It's very common for your doctor to call you back, and our CEO really pushes that. Our doctors love it because they really can develop a better relationship with the patient.
And for them, calling back versus having to do a rotation 24/7 is still a benefit, because if they went anywhere else, they'd be rotating 24/7.
Right. And a lot of times the doctors are able to walk that patient through what's going on, set an appointment for the following day. And again, that senior may be nervous about what's going on with me right now. The doctor is able to make some sort of determination. And again, that keeps them out of the emergency room where the cost and the issues and the overnight stays and all of that occurs. And so, having that, on-demand feature where you're able to talk to the doctor, in off hours, it's huge.
Now, you may not be prepared for this question because it's kind of aside from Gen Care, but
I'm married.
You're what? You're married?
Yeah, I'm married. But thanks for asking.
Well, that wasn't what I was going to ask, but cute. So if someone were to call after hours, because these doctors are capped at $450, and every time you go in, you're seeing your doctor, you're not seeing 3 different other people who might be a nurse practitioner or a physician's assistant.
Right.
Then one can assume that these doctors and these patients really know each other pretty
really
well.
Do. They really do.
And so if you were calling, like, say, with the flu symptoms, and I just think medicine might be heading in this direction, but there's still a lot of barriers to getting this kind of care.
Right.
I have the flu. I want you to call me in a prescription.
Right.
Or maybe flu is not a good idea because you have to check if it's bacterial or viral. But whatever.
Right.
Can I get this prescription? Well, no, you have to come into the office for an office visit. Are you all still there? And that's probably not a fair question to ask you because healthcare in general is still there.
Right.
But I'm just wondering your all's philosophy on that. Do you see that headed in the future?
I do. And I think that, and we will do that on some occasions. If there's a situation where the doctor is comfortable saying, hey, I'm going to, e-prescribe, kind of electronically prescribe something for you. Correct.
Yeah.
We'll do it. Again, our bottom line is what is going to keep you healthy?
Especially for seniors. You don't want to put them out in that kind of cold when they're sick. I really think this is where we need to
keep the model simple. What's going to keep you healthy? What is the best call right here, right now for your health? Not complicated on, what's your medical coverage, what'll keep this good, what'll keep that good. If it's a really simple conversation, and the conversation is, what can I do to keep you healthy? Everything else seems to fall in place, and that's our philosophy. That's our model. What can we do to keep our patient healthy? And if it's an on-call situation and it's calling in a prescription, we'll do it.
Now let me ask you this, and the answer may be no, and it's okay because most people aren't doing it. But y'all have a pharmacy.
Yes.
And you have transportation.
Yes.
Would you ever deliver meds, or is that illegal?
We would.
Okay.
We would. Yeah,
There's so many benefits.
We're able to drop medicine. We had a situation in a center one time, and it was actually in Virginia, and I was told this story, and it just really dawned on me how important transportation and how important having a pharmacy is both at the same time. We had a patient who went and visited a relative and left their medicine there, came back and said, "Oh man, I left my medicine. I forgot." They called us actually on the way back, said, "I forgot my medicine." And so we set it up where we could deliver a refill basically the next day. And so that was one of those type situations where it just made sense for us to be able to have that private pharmacy in our center and deliver it. And we're also waiving copays on those medicines as well through that financial waiver program if they qualify. Because again, if you're not taking your medicine,
it's going to cost more.
You're gonna feel worse, and then you're gonna feel worse, and you're gonna go to the emergency room, and then it's gonna cost you more. It's gonna cost the system more, and so it's huge being able to have that financial waiver to see our doctors and having that financial waiver extend over to that pharmacy as well.
And I see other benefits there too, because when my dad was dying of lung cancer, we talked about that earlier in the show, I remember the last few days of his life, and he needed OxyContin. And we couldn't get the pharmacy to fill it. We then had to leave the pharmacy, drive 15 miles to the physician in a different town in Massachusetts to get the order written. They couldn't even accept it over the fax.
Yeah.
And then drive it back to the pharmacy to pick it up and bring it home to my dad, who was dying, and my mother was a wreck that she was gone for an hour running this ridiculous, in my opinion, errand.
Yep.
When he is dying of cancer, you clearly know this. This has been a long time. He needs this medicine. We can't get it. There's no collaboration. Well, you now have doctors, your own pharmacy, and transportation. I can see, and I lived through how that could be an enormous benefit, not just for the patient, but for the loved one.
But for the extended family, those advocates around that senior love it, because the seniors, their normal experience is they're going to get a prescription from their doctor, and then they're going to leave and go to a pharmacy. The pharmacy is going to say, "Hey, we'll have this done in about 2 hours. Can you wait?" And so it's that's the question: do you want your grandmother waiting for 2 hours on her feet in a pharmacy waiting on her to get that prescription?
And not only that, just the collaboration.
Yeah.
So again, folks, there's 5 offices in Atlanta. They are on the West End, East Point, Morrow, Buford Highway, South DeKalb. There's plans to grow by how many offices? 2014?
This year we're looking at possibly adding another 5 centers.
Another 5 coming in 2014. They've only been here. This is the second year. Keep an eye out for these Gen Care centers. And if you want more information or to investigate whether you can get a PCP, primary care physician at a Gen Care center, then you can go to their website at www.gencaremed, that's JENcaremed.com, or you can contact them in Atlanta at 404-406-7389. Richard, thank you for joining me today. We never have enough time. I'm Jean Pete. Thanks for listening. I'll see you again next week. I'm Jeannie Pete. Thanks for listening. Have a blessed day and week ahead, and listen here same time next week and every week. Homestead Hope Foundation is your resource for a healthy life. God bless.